News now from our D.C. newsroom. The latest data on victims of the coronavirus show the illness is ravaging communities of color across the county like Milwaukee and Chicago. Our D.C. correspondent Raquel Martin has details on how lawmakers are looking to expand their health care options.
Some congressional lawmakers say they aren't surprised by new data showing African Americans are at greater risk of dying from coronavirus.
The pandemic has highlighted many of the underlying concerns that the Congressional Black Caucus and Hispanic Caucus have been talking about for decades.
Indiana Congressman Andre Carson says poor housing conditions, lack of resources, and underlying health conditions in black communities created a perfect storm for the virus.
Our asthma rates are higher, diabetes rates are higher, hypertension.
African Americans make up more than 70% of deaths in Chicago, Milwaukee, and Louisiana. In Missouri, Congressman Emanuel Cleaver says a lack of health insurance could be why.
They go to a doctor, it is to the emergency room, going there when everything has been exacerbated, when their body has just about been worn out.
According to the Kaiser Family Foundation, African Americans are 1.5 times more likely to be uninsured than white Americans.
I think we need to get beyond political talking points and address the core root of this issue, and it has to do with the lack of having health care for all people.
It says to me that we need to make reform.
Right now, Wisconsin Democrat Tammy Baldwin says the country needs more information about how different groups are being affected.
The CDC has not been forthcoming.
Baldwin and the Congressional Black Caucus are calling on the CDC and all states to include racial data in their pandemic reports. In Washington, Raquel Martin.
And lawmakers are also urging congressional leaders to boost funding for health care centers to prevent more deaths.